Hello, I'm Dr. Bittiker. I'm back to do another pause. This time we're going to be covering the bowels. Bowel pause, colon pause, whatever you want to call it. It's a dysfunction that's common to occur in people as they get older, and also it's got certain other names too. Common name for this condition is, or similar conditions, is irritable bowel syndrome, irritable bowel disease. In the more severe forms, it's called like ulcerative colitis, and it really gets bad, it's called Crohn's disease. They're all kind of the same thing along the spectrum, but it's a dysfunction of the bowels. And it leads to a lot of problems. One of the issues that occurs here is that the lining of the insides of your intestinal tract, it has special cells in there, and these cells seal up the lining of the intestinal tract, and they got many little folds in them. In fact, if you were to take all the your intestinal tract that you absorb your food through and flatten it out, it would cover an area the size of a football field. So you literally absorb all your nutrients through something the size of a football field. And that membrane, the way it is set up, is very important that it works correctly, because it's supposed to let certain things come through into your bloodstream so that your body can pick it up and utilize it to build muscle, to build bones, to whatever it takes to your body needs it for, but also to stop other things from coming through that are not supposed to come into your bloodstream. And this is where we get into a whole host of conditions called autoimmune disorders. Now, people listen to my radio program and hear me mention all the time when somebody has a particular autoimmune disorder, such as rheumatoid arthritis, even osteoarthritis. Alzheimer's is probably autoimmune, Jorgen's syndrome, lupus, and we can keep going, MS. They're all autoimmune disorders. They usually have a component or a causative factor coming from the intestinal tract, and here's why. You see, if you have literally intestinal permeability problems, where you literally have holes, it's called leaky gut, in your intestinal tract, things that you consume in your diet that are not supposed to get through into your bloodstream do get through, and they cause a problem. And here's what happens. Some of the proteins and other things that come through the holes in the intestinal tract resemble the same type of a coating of a protein that coats, say, a bacteria or a virus or even a cancer cell. But that protein may also be something that, say, for instance, your body wants to use to put in, for instance, your cartilage in your knee. So it puts it in there. The trouble is your white blood cells use a thing called chemotaxis to track down. They literally, like bloodhounds, they literally smell germs, and they are attracted to that particular protein that happens to be in your joint, and they start to attack it. They try to kill it, like they do like a germ. In other words, your immune system thinks it's doing its job, which is to try and kill invaders. It just so happens that invader really isn't an invader. It's something that's on your cartilage. And if it's your heart, it's called the cardiomyopathy. If it's your brain, it's called Alzheimer's. If it's your bones, it's called rheumatoid arthritis. If it's in the guts, it's called ulcerative colitis. So in other words, the inflammation process can be caused by a leaky gut syndrome. So this is something we see in people all the time. It's very common as people get older. Now, what causes this? Well, we're having a lot more problems here in the West than they have in other parts of the world. There's several reasons for that. One of the reasons is one of the most common causes of at least that sets us off in a lot of people is the use of antibiotics. I've seen this happen time after time. I have patients who say, I was age 35, never had irritable bowel syndrome, nothing like that before. And then we track it back to say, well, then I went on an antibiotic for an infection, and after that I had IBS for the rest of my life. They never put two and two together. You do know that when you take antibiotics, a very common side effect is diarrhea, gas, bloating, and upset in your intestinal tract. It's very common. So, and there's ways to counteract it. By the way, if you do take an antibiotic, I'm not saying don't do that. I'm just saying you may need to do it. But protect yourself from it. It's actually pretty easy to do. If you take an antibiotic for some type of infection, orally or whatever, and even if you take it by injection, you should take a probiotic, something like BioPro, a good one that has the good bacteria in it. They're probiotic. In other words, they're the good type of germs that you want in your body that displace the bad germs in your intestinal tract. Also has the fructooligosaccharides, which feed the good germs and inhibit the bad guys. So you do that. If you take that an hour or two away from your antibiotics, you get usually a good effect from the antibiotics, but you don't get the bad effects from it because the BioPro will protect you from the side effects of most of it. A lot of times you may break out a rash from that. That can be due to bacterial upsurge in your intestinal tract, but also a decrease in the B complex. One of the symptoms of B complex deficiency is a rash. Now, other causes of the chronic irritable bowel syndrome can be things such as your diet. You know, I'm looking at a study here where ulcerative colitis patients, they just did one thing with these people. They took them off of sugar, and about 80% of them got quite a bit better. Also, they took them off of dairy and wheat and yeast products, and again, 50 or 60% of people got better when they did that. So there's a group of foods. Now, that's one of the reasons why we recommend the paleo diet. You can go on Primal Palate website. It's free. You can get a menu there. You can follow the paleo diet or ketogenic diet. We put patients on that all the time. You'd be amazed at how people who have chronic ileitis, chronic irritable bowel syndrome, go on that diet, clears up. Another thing we find out is a lot of times there are other diseases like rheumatoid arthritis also clear. It's very common that when you clear up somebody's irritable bowel syndrome, their autoimmune disorders either go away or get a heck of a lot better. And I'm talking about everything from MS to cardiomyopathy to thyroid, hypothyroidism. Again, I've seen multiple cases that when you clear up somebody's irritable bowel condition, the thyroid issues go away. They no longer need the medication. So it's a pretty useful thing to have this knowledge. Now, let me tell you some other things that we do to help people to combat this problem. And also, I want you to know that there is a general overall association with irritable bowel syndrome and a whole bunch of other diseases. For instance, malabsorption syndrome. If somebody has chronic diarrhea, you simply cannot be absorbing your nutrients like you should, even though your diet may be fairly decent. You're not absorbing it. It can lead to malabsorption. It can lead to fevers in some people. It dramatically increases the likelihood of developing colon cancer if you have irritable bowel syndrome. Also leads to a host of other conditions and chronic fatigue, loss of weight in some people, and just pain. I mean, sometimes it can be very painful. Now, as I said, one of the main things we do for people is we do a dietary changes, and that's a biggie right there. Because most people are eating foods that you're allergic to. Also, if you want to go into this in more depth and detail, you might want to get Dr. Gundry's book, The Plant Paradox. In there, he goes into a lot of details about the things that are found in some of your foods, like lectins and some of your other things that occur in foods. And you understand that some people are super sensitive. I mean, a good example is the peanut, which is not a nut, it's actually a bean. Only about maybe 8 to 10% of the population does not have some allergic reaction to peanuts. So those people, I guess they're lucky. They can eat peanuts all they want. But there is about less than 1% of the population that you give that person a peanut and it may kill them. They are that sensitive to it. So there's a lot of variability here. Also, I find out that when people fix their irritable bowel syndrome, a lot of times their food sensitivity issues go away. They find out occasionally they can eat the food that they couldn't eat before and get away with it as long as they don't do it too much. Now, a couple of things that we do to help our patients get rid of their irritable bowel. One of them is, surprising enough, this has been found kind of in a lot of anecdotal studies, but I've seen it myself. We do a vitamin D test on our patients when we do a nutritional consult on our patients. And I would say 80% of the patients that come in here have a vitamin D deficiency according to the laboratory test, not just me. I think the number should be higher than what the laboratory has, but that's just me. But when we give them vitamin D, a whole bunch of these IBS patients, irritable bowel syndrome patients, get better. It was just a vitamin D deficiency. If you go to vitamind.org council, their vitamindcouncil.org website, you can see the research on it. You can see that vitamin D has been used to treat irritable bowel conditions. Some other things that help a lot is the vitamin B12. We usually do that when we give our patients the Nutrient 950. And that's one of the reasons why a lot of irritable bowel patients have pernicious anemia. That's where they get numbness and tingling in their feet. Comes from the IBS. You see how they go together. Also, we use a product called GI Integrity, and some of the things it has glutamine in it. Glutamine is a very interesting thing. It's an amino acid that actually feeds the enterocytes that line the intestinal tract, and it actually, within a matter of a week or two, can cause little holes in the membrane in the gut to seal up, and it heals the gut. We've used this on patients who even had ulcerative colitis where they have blood in the stools. That's a more severe form of it, and it actually helped them a lot. Also contained within this is the N-acetyl-carnosine here. Let me see here. And also the aloe vera. Aloe vera has a signaling molecule in there that signals the epithelial tissues to proliferate, to multiply. The aloe vera is a naturally occurring epithelial proliferant. That's why it's good for your skin. It's good for your stomach. And good for the lining of your intestinal tract because it stimulates the cells there to actually multiply and seal up those little holes like the glutamine does. We also have the gamma oryzanol, which seems to feed the enterocytes, gives them all the nutrients they need to get nice and healthy. And also, it contains, as I said, the aloe vera. But now, one other thing I want to mention is the digestive enzymes. We use this with our patients to initiate the digestive process, because one of the reasons why some people get irritable bowel syndrome is their stomach's not working correctly. If it's working correctly, fine, you don't need to worry about that. But we use the enzyme HCl. I have a patient take one with each meal, with a probiotic one with each meal in the beginning. They can usually reduce that after a while. This breaks down the stomach. It also then further breaks down, it's a two-phase digestive. Part of it breaks down the stomach, the other part breaks down the intestinal tract. Now, so I want to point this out and get you to understand this. If you have any type of an autoimmune disorder, look it up on the internet what autoimmune disorders. You'll find there's a whole bunch of them. It's where your own body's immune system is attacking. And if you have any symptoms of irritable bowel syndrome, if you fix that first, a lot of times your other symptoms are going to get a lot better. And remember, the symptoms of irritable bowel can be constipation, or intermittent diarrhea and constipation, gas and bloating, fatigue after you eat a meal. Sometimes your pulse will beat faster after you eat a meal. In other words, you're getting some kind of allergic response. That's irritable bowel syndrome. It can vary all the way from a very light condition to life-threatening. I mean, severe Crohn's condition can be life-threatening in some people, so you don't want to go down that road. Okay, well, I've covered that particular topic. If you have any questions, you want me to cover a topic, remember this is kind of like the internet. It's called interactive net, so to speak. That means if you've got a question, you wonder about something, email me, text us, whatever you want to do. Call us, 800-326-5838. That's 800-326-5838. Ask a question. And if I don't know the answer, I'll research it for you, get back to you with the proper answer, and cover it here on the Facebook. If you like us, you know what to do, and share us with your friends so more friends can learn about us. And also, as I said, they want to contact me and ask a question. We're here to get you the answers. Thanks for watching.